In the mid-20th century, a severe bone fracture or a deep infection usually carried a singular, grim prognosis. Doctors had very few tools to rebuild shattered limbs, leaving patients facing permanent disability or the surgeon's amputation saw. The solution to this widespread suffering did not emerge from a prestigious medical academy in London or New York. It came from Gavriil Ilizarov. He grew up in rural Azerbaijan, graduated from a preparatory school meant to train peasants, and lacked any connection to the elite tiers of Western medicine. By 1944, Ilizarov was sent to work as a general surgeon in the remote, under-resourced Kurgan region of Soviet Russia. He found himself in a tiny hospital surrounded by unpaved roads and agrarian poverty. The local population consisted heavily of agricultural workers suffering from severe, untreated bone trauma. The sheer volume of mangled limbs coming through his clinic quickly exhausted the limited options outlined in standard medical textbooks, forcing him to experiment on his own. True medical innovation is born from a desperate proximity to a problem, far away from the insulated walls of a prestigious academy. Ilizarov constructed an unorthodox external fixation device. He cobbled together metal rings, threaded rods, and tensioned wires that looked like bicycle spokes. He drove these wires directly through the patient's skin and bone, securing them to the metal frame outside the leg. The apparatus relied on two mechanical actions. First was compression, forcing the fractured ends tightly together to stabilize the break. The second was distraction. The external frame was turned to slowly pull the segments apart. In 1952, the Red Kurgan newspaper reported a staggering result. Ilizarov had successfully grown new, healthy bone tissue, lengthening a patient's leg by 12.5 centimeters. This impossible clinical result forced the USSR Ministry of Health to officially permit the application of the device. A radical mechanical solution achieves legitimacy only when it generates undeniable physical proof in a patient's recovery. For over a decade, this technique remained largely isolated in the Kurgan region, but in 1968, the scope of Ilizarov's practice expanded when an unprecedented patient traveled to his clinic. Valery Brumel was the Soviet Olympic high jump champion. Following a brutal motorcycle accident, his athletic career was considered over by the medical establishment. Refusing to accept the prognosis, Brumel sought out Ilizarov's remote facility out of pure desperation and underwent the unique fixation treatment. The treatment worked. Brumel's successful recovery propelled Ilizarov from a fringe doctor to a celebrated national hero in the USSR. A surgeon does not need to chase recognition. Mastering a revolutionary craft will eventually bring the world's champions to their door. By 1980, Ilizarov was a Soviet icon, yet the Western world knew almost nothing about him. The Iron Curtain kept Soviet medical science largely hidden and frequently dismissed by Western doctors. That barrier cracked when Carlo Mauri, a well-known Italian explorer, traveled to Kurgan seeking treatment for a ruined limb. When Mauri returned to Europe, miraculously healed, the Western medical community was stunned by this unknown Soviet technique. During his 1982 trip to Italy, Ilizarov dominated the Lecco International Congress. He was granted 2 hours for each of his 4 lectures, captivating an audience of skeptical Western surgeons. Undeniable clinical outcomes act as the universal language of medicine, capable of shattering both skepticism and geopolitical borders. Global scrutiny eventually revealed that Ilizarov's discovery went deeper than a new surgical tool. He had uncovered a fundamental biological rule, formalized in 1988 as the tension-stress effect. The tension-stress effect dictates that controlled, gradual mechanical tension actively stimulates the regeneration and growth of living tissues. By pulling the bone apart at exactly 1 millimeter per day, he coaxed the body's own cells to rapidly multiply and bridge the gap. Following this discovery, the tiny, muddy clinic evolved into the Kurgan Scientific Research Center, a massive snowflake-shaped hospital treating 9,000 patients annually. Surgeons around the globe scrambled to learn the technique. They formed the Association for the Study and Application of the Method of Ilizarov, establishing training centers in more than 40 countries. Today, the technique manages everything from complex blast traumas to severe congenital bone defects. It has become a standard tool for correcting the most difficult skeletal pathologies known to medicine. A surgeon's highest achievement is looking past a shattered foundation to engineer the capacity for entirely new growth.